Well, non-essential doctors' appointments are off the table as patients shelter at home to prevent the spread of coronavirus. Colonoscopies, mammograms and screenings that diagnose cancer have fallen dramatically, as have other cancer-related appointments. As a result, cancer patients are at increased risk of infection and developing severe complications during a COVID-19 pandemic. We're now joined by Salome Meyer, who is the project manager for Access Medicine Cancer Alliance, for more on this discussion. Thank you so very much for joining us here on SABC News.
Thank you, Florence, and good afternoon to you and all the viewers.
Now, a letter has been penned to the Health Minister, and of course I can imagine that cancer patients are faced with the same challenges that other patients with diseases are currently facing since the start of COVID-19, and that's of course of resources being less due to attention now being focused on COVID-19 patients. Take us through really what's being said then to the Minister.
So I think what is of importance is that cancer patients, in any case, face a challenge when they receive a cancer diagnosis. So what is now currently happening is that cancer patients within the public system are facing an even larger challenge. And some of those aspects relate to, for instance, the fact that they cannot get transport to their treatment, those who still have their treatment scheduled. You have a situation where there's a lack of understanding by the security forces in terms of which patients can be transported. You have situations where patients are have to be transported between provinces, and for that there's been no special recognition has been given to those specific patients. So the lack of understanding and the need from a cancer patient's side has not really been addressed by the emergency regulations. And part of our request to the Minister is to actually then that those kind of aspects needs to be investigated so that one could see what it is that one can put in place with regards to the transportation as well as the accommodation of cancer patients during COVID. What we also are asking for is that cancer treatment across the country has to be scaled down. It is a reality. So our cancer specialist clinicians at the various public hospitals are working hard with regards to how do they accommodate the patients to actually make sure that they do not necessarily bring them to hospital where they can actually be infected by COVID, but still maintain treatment, whether it be telemedicine, whether it be seeing if they can actually push out the treatments over a longer period. So those are the kind of things that our clinicians are doing from a hospital perspective. But what we also are asking is that there be a uniform planning with regards to what is happening in all provinces. And we're asking the Minister specifically that he asks his advisory committee on cancer prevention and control to also include the specialists from the public service to actually plan what is going to happen during COVID, but we also need to look at what is going to happen beyond COVID. When you started, you mentioned about cancer diagnostic services that is being scaled down and is already being impacted. And that actually means that we're going to have a lot more patients that are going to be diagnosed with late-stage disease.
I'm just interested in something that you just mentioned now, which is, of course, a logistical thing, but very important. The fact that cancer patients would have to be moving up and down and around and, might even be from province to province. In the meantime, since we've been having these lockdown regulations that have been implemented, what have cancer patients been doing, and how have they been traveling? Is there any sort of, I suppose, permit? What have they been doing in the meantime?
So the only thing that cancer patients have at this stage of the game to assist them are their appointment cards, and that's it. Nothing else. So the hospitals can provide them with letters, possibly, in order to help them. Yeah. But sometimes they only have their hospital cards, and that is what they can show as proof that they actually have an appointment. We've had a patient, and we've had patients in Gauteng that have been turned around by the security police or security forces, and said to them, "You can't go for your treatment," and then those patients have to go home. There's some patients that cannot get access to taxi services, then they're stuck. So those are the kind of real challenges that cancer patients face.
Yeah, and cancer patients, as you mentioned, are at an increased risk of infection and, perhaps developing severe complications during COVID-19. Talk to us about, how cancer patients can be even more protected from exposure to COVID-19. And then I would imagine that those that are more vulnerable in our societies are even more at risk than someone who's perhaps, from an affluent sort of background,
One of the aspects and one of the calls that we've been had from cancer patients specifically is to look at when patients have to, for instance, access a shopping center to go and buy their basics, that the security at this shopping center also allow them preferential treatment. But then there again, the cancer patient now have to first go into a whole negotiation with regards to, I am a cancer patient, and some of the security people are just ignorant. So what we actually do need is a big, I want to say, awareness drive that cancer patients, just like other non-communicable diseases, are actually at a high risk of COVID-19. And that is very important. And if we can all work together to get this message out to business, but also to the general population, that cancer patients are at risk.
All right, Salome Meyer, thank you so very much for giving us your time and highlighting, of course, for us the plight of cancer patients. And hopefully you will be heard, and that letter that you penned to the Health Minister will indeed be given urgent attention that it deserves. Thank you very much for your time.
Thank you, and stay safe, everyone.
Same.